I'm sure I'm not alone when I say that sometimes in the middle of the day, your energy's low, you can't remember a word, you're feeling like you're dealing with a little brain fog.
Yes, well, ladies, as we get older, there could be a variety of medical issues behind all of this. So, Sylvia Castaneda headed to Maury Regional Health for answers.
Good sleep, a balanced diet, and exercise are all good habits that can keep our health in balance. But if you feel you're doing all these things and still feel tired, then it may be time to see the doctor. That's why I'm here at Maury Regional Health with Dr. Kelsey King-Hook. Dr. Hook, as a primary care physician, you hear a lot from your patients. They may be complaining about fatigue. Women may be complaining about brain fog. What's behind all these symptoms?
That's a great question. There's many possible causes of fatigue, especially in women. Let's dive into those today.
Great.
Let's start with depression. Depression symptoms can often worsen in the winter and fall months. Common symptoms of depression include feeling down or sad, decreased interest in things you used to find enjoyable, changes in appetite, concentration, and energy, and also feelings of guilt. We have a screener online that goes through the common symptoms of depression. This is actually what we use to diagnose our patients in the office.
So, doctor, if the screener shows someone may be suffering from depression, what are the next steps?
Great question. So definitely reach out to your physician for further assessment. The good news is there are many treatments available for depression, including counseling and medication therapy. Another condition which can cause fatigue is sleep apnea. With sleep apnea, your airway can collapse and your body does not get enough oxygen. This prevents a good night's sleep. Major risk factors for sleep apnea include snoring loudly at night, feeling tired or fatigued during the daytime, and witnessed apneic spells. That's if someone's ever witnessed an episode where you stop breathing during your sleep, or if you have a history of high blood pressure. Other risk factors include a BMI greater than 35, age greater than 50, the male gender, and a larger neck circumference. We have another free screener online that goes through the risk factors of sleep apnea. If you have several risk factors for sleep apnea, your doctor may want to obtain a sleep study. Fortunately, Maury Regional has a sleep lab here to assist with diagnosis. As for treatment, a CPAP machine is a good option to keep your airway open so you can get a good night's rest.
Doctor, what about your thyroid? I heard that's an issue for women as we get older.
Definitely. The thyroid gland controls your metabolism. If your thyroid gland is underfunctioning, we call this hypothyroidism, which can lead to fatigue. Besides fatigue, symptoms of hypothyroidism include cold intolerance, weight gain, dry skin, constipation, and voice changes. You may be at an increased risk if you have a family history of thyroid disorders. Blood work can let us know if you have a problem with your thyroid, and treatment involves thyroid medication.
Now, what about a vitamin D deficiency? Can that make us tired too?
Vitamin D deficiency can also make us feel tired. Other common symptoms of vitamin D deficiency include muscle weakness and muscle and bone pain. Diagnosis is made with blood work, and treatment involves high-dose vitamin D supplementation. Another common cause of fatigue that's diagnosed with blood work is anemia. The most common cause is iron deficiency. Symptoms can include weakness, fatigue, shortness of breath, increased paleness of your skin, or lightheadedness, especially with changing positions like from sitting to standing.
So how do you treat this, doctor?
Great question. So iron deficiency anemia is treated with iron supplements. However, older adults may need further workup to determine the cause of their iron deficiency. This may include further workup, stool studies, or a colonoscopy and endoscopy with your GI doctor.
Okay, doctor, one condition that all women will one day face is menopause, so how's that tied into fatigue?
So during menopause, your body goes through huge changes in your hormones. This can affect how you sleep, leading to fatigue. In fact, menopause symptoms can affect almost every body system. Symptoms can include irritability and mood swings, hot flashes and night sweats, and vaginal changes.
So how is menopause diagnosed?
So menopause is diagnosed clinically after you've had loss of your menstrual cycles for 12 consecutive months. Your doctor may want to get other blood work though, depending on your risk factors and medical history. The good news is there's many treatment options available to control the symptoms of menopause. This includes lifestyle changes and both hormonal and non-hormonal medications.
Love that. So I know we've covered a lot of ground today. So why is it important that women not ignore these symptoms and get into their doctor to be checked for any of the things we've talked about?
Some of these conditions can cause unwanted side effects. For example, untreated sleep apnea can increase your risk for heart attack, stroke, and even diabetes.
Doctor, thank you so much for giving us such great, valuable information. Sending it back to the studio.
Thank you so much. We'll visit mauryregional.com/fatigue to find out more information. Of course, such great information that Sylvia always likes to bring us. And again, that number is 931-380-0075. And always talk to your doctor for help.
Exactly.